At the start of year 2020, a global pandemic hit humanity real hard, upending the lives of millions of people all around the world. As borders were sealed, schools closed down, and businesses shuttered. With the rapid increase in the number of people affected by coronavirus, healthcare systems across the globe have been facing new challenges. And it has been no different for Pakistan. Due to the expected increase in the number of patients, temporary hospitals are being established in various cities throughout the country. In order to cope with these difficult and challenging times, a need was felt to construct a purpose-built hospital to treat patients with coronavirus in particular. National Disaster Management Authority, in collaboration with National Institute of Health, developed the initial plan of such a hospital that was to become first of its kind in the federal capital. Honorable Prime Minister Mr. Imran Khan laid the foundation stone of this hospital on 26 March 2020 in a simple ceremony. As the project had to be completed in a very short span, FWO was entrusted with the construction of the hospital. In times like these, where the entire country was in a lockdown, the challenges to initiate the project were manifold. From health risks involved due to the spread of COVID-19 to a nationwide lockdown, limiting the availability of resources such as funds, workforce, transportation, construction material, and much more. Due to time constraints, FWO's team started the planning, designing, and construction of the hospital simultaneously. With just a simple one-line plan in hand, provided by NDMA and NIH, FWO developed a thorough 3D model using building information modeling, a 3D model-based process used to efficiently plan, design, construct, and manage buildings and infrastructures. The Isolation Hospital and Infectious Treatment Center Islamabad comprises of 5 major complexes: Patients Complex, Diagnostic Complex, Administration Complex, Residential Complex, and Services Complex. Concurrently, as the plans were being finalized, site preparation for construction also began, from leveling the ground to setting up safety precautions. Keeping in view the pandemic, FWO installed disinfectant walk-through gates and made arrangements to provide protective gear to all professionals and labor working on site. Once the groundwork was complete, the work picked up pace. For the construction of the building, prefabricated steel structure has been used. The walls have been furnished with sandwich panel steel sheets that are resistant to germs. Complying with international standards for isolation hospitals, the building is equipped with high-efficiency particulate air filters that trap air pollutants, enabling allergy relief for the patients. Patient Complex has the facility to accommodate 250 patients at a time. The rooms are equipped with state-of-the-art facilities, having fully automated ICU beds, mechanical ventilation, heating and cooling ventilation, and attached washrooms. For isolation rooms, both negative and positive pressure rooms have also been built. Keeping the environment of the hospital safe and clean has been the utmost priority for this project. Therefore, the hospital has a thorough waste management system to manage hazardous medical waste. A chemical sewerage treatment plant has also been installed to treat the sewer waste. FWO has also rehabilitated the existing but non-functional sewerage treatment plant of the National Institute of Health, which has now become semi-functional. The diagnostic complex constructed in the vicinity of the hospital is equipped with radiology and laboratory facility to ensure quick availability of medical tests and reports. A well-furnished residential complex has been constructed alongside the hospital, providing an accommodation for 20 persons that include emergency medical staff and doctors. For provision of safe drinking water, reverse osmosis water filtration plants have been installed. In case of an emergency, fire detection and suppression system to extinguish fire without human intervention has also been installed. Isolation Hospital and Infectious Treatment Center has been constructed with the vision to effectively and efficiently fight the COVID-19 pandemic. Once the pandemic is over, the hospital will be dedicated to treat patients suffering from infectious diseases by providing diagnosis and treatments for them. FWO's dedicated and hardworking team of engineers, professionals and laborers work tirelessly day and night to turn this dream into a reality. This hospital is a landmark achievement, not just for FWO, NDMA and NIH, but also for the entire nation. FWO, Sustaining Excellence.